Hi, my name is Ciaran Cosgrave and I'm a consultant in sports and exercise medicine at the Sports Surgery Clinic in Dublin. I'd like to talk to you today about pain in the lateral aspect or outside of the hip. This is a very common condition here at the clinic, and while there are many different causes of it, I'm going to focus on the most common cause, which is gluteal tendinopathy. This is a condition that can exist in isolation or often coexists with a second condition called trochanteric bursitis. And I'll explain these in a bit more detail in a few minutes when we have a look at the anatomy. Patients who suffer from gluteal tendinopathy tend to complain of pain in the lateral hip that comes on with activity. They also report pain that can come on with sitting or driving, or pain that comes on when you lie on the affected side. The pain can radiate into the buttock or down the thigh. And if you're experiencing pain in your groin or lower back, or if you have neurological symptoms such as tingling or pins and needles, there may well be a different explanation for your symptoms that might need to be reviewed.
So if we take a look at the anatomy, we're talking about pain in this area. And if we remove the larger gluteus maximus and TFL muscles, we can see that the gluteus medius and deep to this, the gluteus minimus, both attach via their tendon to the bony bump on the outside of your hip called the greater trochanter. Additionally, we can see these small fluid-filled sacs called the trochanteric bursa. And in people who do a lot of activity such as walking and running, they can get an overload or degenerative condition in the tendon called tendinopathy, or an increased friction in the bursa called trochanteric bursitis. So the mainstay of treatment is to strengthen the gluteal muscles, which in turn stimulate the tendon to heal. And additionally, by improving strength and control in this area, you can minimize the chance of the pain coming back again as you resume your activity. So I'm now going to hand you over to Sam Baida, our rehabilitation specialist, who will talk you through your exercises.
Cool. Howdy, my name's Sam Baida. I'm a senior physiotherapist here at the Sports Surgery Clinic, and today we're going to go through some rehabilitation for lateral hip pain. And this will follow on from Dr Cosgrave. He talked about the anatomy and the presentation and how largely we're looking to offload that area by strengthening the lateral hip or gluteal muscles. So we'll run through a few exercises now that target different aspects of rehab and muscle strength or power. So the first exercise here is that half kneeling hip turnout. Now we can see here some of the important parts of the setup is that front knee is at 90 degrees and the hips and trunk remain still and keeping the core muscles tensed up. So the movement should come from the lateral hip, keeping the core muscles engaged. And we can see here we slowly turn the band out. We should feel the left glute muscles working hard, and then pause at the end and slowly return to the start position. And slowly return to the start position. So the second exercise is the hip hitch, and this works more the deeper hip muscles. And again, the key to this setup is we're supported on the box and our standing legs doing all the work as we hitch the left side of the hip up using the right leg. So the key points here is to maintain that upper body, keeping it still, and then squeezing the right hip to hitch up the left. And we should feel all the work happening on that right side of the hip muscles. And our last exercise is more to do with the power at these hip muscles. So we're looking at a switch step. So here we can see we move quick and maintain a nice still position at the end. So we drive the left knee forward and lock out the right knee in that mid-stance hip lock position. So we move fast and we're nice and still at the end of the movement for 2 seconds. So again, switch and lock out. Drive the left knee through and lock out the right side. So that takes us through 3 basic exercises that we can target the strength and power of those lateral hip muscles And these are nice because we can do them easily enough at home. When we do these, it's really important that we feel those glute muscles working really hard and in the right areas before we look to progress them on.